cervical cancer. This month, January, is Cervical Cancer Awareness Month. So we have an opportunity to have a senior colleague, senior gynecology specialist, going to share with us on cervical cancer. It's causing a lot of distress, a lot of cancer deaths are arising from cervical cancer, lots of financial issues and all that. So please, join me, specially welcome a senior brother, senior colleague, Dr. David Wilfred Parker Alote, to share with us all on cervical cancer. Senior, over to you.
All right. Thank you. The study here. I can all hear me and see hello on the chat box so that I know that you can all see me clearly. Box.
Yeah, your line is breaking, so I think I'll put a video off so that you can just do audio.
If you can hear me or see me, just say hello. Just can you all hear me and see me clearly?
Yes, I can see you, I can hear you, but your line is breaking. So if you can put the video off so that we do audio.
Okay. All right, can you all hear me?
Yes, can hear me loud and clear now. Yes, go ahead, please.
Is it breaking? Beautiful.
Yes,
beautiful.
Clear.
All right, so my name is Dr. Parker. I'm a gynecologist specialist, and I'm happy to see that we have a lot of people on the call. That means a lot of people are very much interested in cervical cancer. All right, you have a few minutes. Just keep on letting anybody who is not on the call now join the call. All right, just let anybody who is not on the call join the call as we start. It's going to be brief, but it's going to be very impactful. All right, cervical cancer is a very important cancer. It is one of the top killers of women in the country. And one thing I always say about cervical cancer is, you know, most cancers are unpreventable. You don't know, you're just there and then boom, one day you realize that you have a cancer. A lot of cancers, you can't even notice it coming. It just comes just like that, all right? But cervical cancer, the irony is that cervical cancer is one of the few cancers that can actually be prevented. There are so many preventive measures, primary preventive measures, and secondary preventive measures. Yet, this is the cancer that is killing a lot of women in our part of the world, which is really, really troubling. And it's just because, one, lack of education. A lot of women, no matter how educated they are, have very little knowledge about cervical cancer. All right, believe it. Trust me, it is horrible. The money the family spent, the emotional trauma, it actually affected with the kids mentally. It drained us because you will be watching the person screaming, having sleepless nights, and there's nothing you could do about it. The person going through pains, crying continuously, and you can't do anything for the person. You are watching someone dying slowly. All doctors are saying is it is too late and you only have your God, and we encourage yourself. We will always wake up feeling happy. We always wake up not feeling happy. We couldn't do anything. The amount of money spent on daily medication was mind-blowing. running to hospital here and there all the time. My sister was also in her final year in the university, about to write her exam. It affected her studies because she couldn't learn. I was out of the country doing business, and I also couldn't concentrate. I was always thinking about home. It got to a point where we could not enter her room. Now listen to this point, Kevin. It got to a point where we could not enter her room because the whole place smelled so bad. We had to hire a nurse who comes there to do the cleaning and take care of her all the time. Anytime visitors were never allowed in to visit her that much because the whole place smells. In as much as we clean, put all the fragrance there, yet within few minutes time, the smell comes back. We got tired, but there was nothing we could do. I have had the chance to witness one clearly, and I thank God there's actually a cure for it by getting tested and taking the shots. So I will encourage each and everyone here to get tested, take the shots, and learn from this horrible experience. It goes on and on and on, but this is just something she wrote. This is somebody who witnessed, somebody who personally has cervical cancer. I tried to get somebody who has survived cervical cancer here to talk, but the person didn't want to. So, but I hope that starts the meeting well. So let me share some slides that I have. I hope you can all hear me. If you can hear me, just say hi in the chat box. If you can see my screen, to just type hi. If you can see my screen, just type hi in the chat box so I know you can see my screen. Just chat hi.
We can see.
Beautiful. All right. All right. So we'll briefly go through few things about cervical cancer. What is cervical cancer? What causes cervical cancer? All right, why we should prevent cervical cancer and how we can prevent it. All right. We're also going to talk about how we spend resources, the magnitude of the problem, and what puts a woman at risk of cervical cancer. All right. So cervical cancer is, as I said earlier, is one of the most preventable of all the cancers that women get. But it's actually rather the leading cause of cancer death among women in Ghana and many African countries. The other close one is breast cancer. All right. Breast cancer and cervical cancer are actually at the top. And you know, the funny thing that these are cancers that we can screen for easily, yet those are the top causes of death when it comes to cancer amongst women. And funny enough, most people present late to the hospital. All right. At the time they present, the cancer has spread, it's gone beyond, it's gone to other organs like the kidney, it's gone to the liver, it's blocked the passage of the kidney, and it becomes difficult to treat. At that point, mostly you can't treat it. You can only help the person to live a more comfortable life. All right. And as you can see, more than about 80% of people present late. They don't come early. And at that point, the treatment is very costly. And so most people cannot also afford it. Now, this is this picture shows the female reproductive organ, as we all remember from school. You can see the womb, and below here is the vagina. And this side, where the cursor is showing, that is the cervix. You know, when a woman is in labor, that is the part of the womb that has to open for it to be 10 centimeters before the baby can come out. All right, so that's the cervix. So that is where cervical cancer affects. That is where it starts from before it spreads to other parts of the body. It can spread down to the vagina, or it can spread up, all right, and to other distant places. So that is what we call the cervix, all right? And that is where cervical cancer starts from. All right, so this picture shows a picture where you can see cervical cancer affecting the cervix, and it has come down to affect the upper parts of the vagina. All right, so this is an illustration of it. So what causes cancer in general? You know, whenever they say you have a cancer, it means your cells are growing abnormally. Normally, you know, everybody, your cells are regulated onto about how they grow. All right, they can't just decide that I'm growing without any control measures. All right, so the cells go through regular checks to make sure that they don't grow out of place. All right, but when there is any problem with these checks, all right, like your DNA is damaged, a virus has affected you, like in this case, cervical cancer, which is caused by a virus, which we'll talk about, the control measures cease, and then the cells begin to grow abnormally. And when they are growing, they don't stay in their line, they end up growing into other nearby structures and into distant, they enter the blood, and then they go to distant places in the body. And that is basically how cancer starts, all right? So when we talk about cervical cancer, why are we talking about it? Because it's a big issue. It is killing a lot of people. In 2012, about 528,000 new cases of cervical cancer was reported worldwide. And normally, you know, when we see these things, we should know that this could even be half the real thing, because most of these developing countries that underreporting, people just die in their homes, never going to the hospital. You get it. So you can actually realize that this may even be an understatement. And in 266,000 deaths in the same year. So about half the cases that were reported, half of that number died. And recent studies in 2020 show that about 340,000 people died in 2020 from cervical cancer. So the death rate is actually rather increasing, you know, from 2012 to 2020. It's even gotten worse. All right, with all the development the world is seeing, why are people still dying of something which should rather be going down, you know? But that is how bad the problem is. And in you can see that over 85% of these cases are all in the developing countries. All right, why are they not seeing those countries in the developed countries, in Europe, in America, in Canada, but they are seeing it mostly in developing countries, all right, which is really sad. And every 2 minutes, one woman dies of cervical cancer. Now let's bring it closer to home. All right, in Ghana, I gave you global estimate. But in Ghana, it is indicated that every year about 3,000 women are diagnosed with cervical cancer. All right, and about half of these women die of cervical cancer. All right, which is bad. And as I said, most of these figures are actually underestimated. This was a study that was conducted in Accra. All right, and the WHO has predicted that by 2025, this number of people being diagnosed and dying is actually going to increase. So it is up to us to do something about it, to prevent that from happening. Because the problem is, most people do not know about cervical cancer. So everybody who is listening to this, it is your duty to tell your family members, the women in your life, to be able to know about cervical cancer, have the knowledge and what to do to prevent it. Okay, so this shows about mostly the different kind of cancers that affect people worldwide. And in Africa, you can see that cervical cancer is actually the top cause of death, you know, in Africa, compared to Europe, which is the reverse. Okay, and this was a study done in Kolebu in 2000 to show the incidence of cervical cancer. So now, let's get to the meat of the problem. What causes cervical cancer? 99.7% of cervical cancer is caused by a virus known as human papillomavirus. All right, human papillomavirus, we call it HPV. Now, this is a very ubiquitous virus. That means almost every woman who has started having sex has been exposed to the virus at a point in their life. That is how bad it is. All right, so if you're a woman and you've started having sex, then it means there's a stage in your life where you have been exposed to the human papillomavirus because it is sexually transmitted. All right, so this is a cancer that we clearly know the cause of the cancer. We know that the cancer is caused by a virus. And every woman who is having sex has most likely been exposed to the virus because it is the most common viral infection which is transmitted sexually. All right. And there are different subtypes of the HPV virus. There are so many different subtypes, a lot, but there are two subtypes, type 16 and 18. They are known to cause the cervical cancer. All right, they are the malignant ones. They cause the cervical cancer. There's another subtype, 11 and 6, and they cause vulvar warts or genital warts. So if you have gotten warts before, that is, you see some growth around your vagina or in your vagina and inner region, which you call warts. It is also caused by the same virus that causes cervical cancer, all right? And they normally move together, all right? And as I said, almost every woman who has started having sex, who has had sex in their life before, has been exposed to the HPV virus. That is how serious it is, okay? And so what puts a woman at risk of getting cervical cancer? One, there are certain things that when a woman does, a risk of getting cervical cancer are higher, all right? And I'll take you briefly through it. And as we go through it, think about yourself, think about people you know, and ask, do they have these risk factors? One, early onset of sexual activity, all right? So if these days, girls are starting having sex very early, by 13, 12, 14, they're having sex. Just before the call, somebody called me that the younger sister, who is 15 years, is pregnant, about 6 months pregnant, right? And they're just finding out 14 years. And she's pregnant, all right? So people are having sex very early in life. So of course, when you start having sex early, the reason is that the probability that you would have been exposed to the HPV virus is very high compared to somebody who probably starts having sex late, all right? Multiple sexual partners. You know, the virus is sexually transmitted. So if you're having multiple sexual partners, that means you are going to continuously reinfecting yourself with the virus. Okay, so multiple sexual partners or a high-risk sexual partner. Sometimes you do not have multiple sexual partners. You have maybe just one sexual partner, but that sexual partner has multiple sexual partners. So that's what we call a high-risk sexual partner. So that partner may end up definitely bringing you the infection, all right? And then you get the HPV infection. Of course, history of sexually transmitted disease. Of course, if you're having sexually transmitted disease, it means you're living a high-risk life. You are not using condoms during sex. And so if you are having other sexually transmitted diseases like chlamydia, gonorrhea, you are also most likely to be infected by the HPV, all right? So far as you say you're having STDs, it means you also have risk. Early age at first birth. So, you know, women who give birth early, it means they obviously start having sex early, all right? So that means the longer exposure to sex puts them at risk of having the HPV virus, and so they are more likely to have be at risk of cervical cancer. And immunosuppression, that is also a big point, and I'll talk more about a weak immune system as we go on. Because when your immune system is weak and you are affected by the virus, your body is not able to clear the infection. Now, what you should know is that most of the time, you may be infected by the HPV virus. But if you have a strong immune system, your body may be able to clear it, all right? And then you are safe. But if your immune system is not strong, then obviously the virus is going to get a place in your system and establish itself there and start going through the changes that will lead to cervical cancer. So immune system, having a strong immune system is always a big plus in preventing most of these things. All right, and we'll talk more about that as we go on. All right, so the other risk factors which are not associated to the HPV virus, all right, something like low socioeconomic status, all right? In my field as obstetrician gynecology, a lot of things a risk factor is the lowest socioeconomic status because, I mean, when people don't have money, they are not likely to go to hospital, all right, when they are sick, all right? They are not likely to be well educated, all right? Of course, when you're educated, you get to know about cervical cancer, you visit the hospital often, all right? So it helps it. But if you are not, then it also becomes a problem. Non-white race. So it's been seen that in most multiracial societies where there are white and blacks, normally it is the blacks who always end up having these kind of diseases. Why? Because most often, you know, whites are more educated than blacks. Blacks more lower socioeconomic status, actually. And cigarette smoking is also one of the big risk factors, all right? cigarette has a carcinogen in it, and cigarettes is also known to reduce the strength of the immune system. Cigarette smoking weakens the immune system, and it helps the HPV virus to establish itself in the cervix. All right, so cigarette smoking is not good. So now, when somebody is infected with the HPV virus during sexual activity, all right, most of the time, if you have a good immune system, you're living a healthy life, your immune system is strong, it's on point, most often your body may be able to clear the virus totally, okay? And then it prevents it from progressing and invading the cells of the cervix, all right? But most often, when you have a weak immune system, it is the virus is able to establish itself and multiply in the cells of your cervix. All right. But of course, another thing that we keep on re-engaging in sexual activity, and you keep on reinfecting yourself and reinfecting yourself and reinfecting yourself. All right. And this also establishes the virus because your body cannot always be clear. You keep on infecting yourself. There'll be a point that you probably do not have a weak immune system, or you may be infected with the highly virulent strains like type 18 and 16, and this may progress. And it also should be known that most often it takes years between the time of infection to the time of developing cervical cancer. All right, so when you're infected with the HPV virus, you do not develop cervical cancer immediately. It takes an average of 15 years, sometimes 10 to 15 years, also depending on how strong your immune system is. All right, people with very weak immune system may develop it within 5 years. All right, but people with strong immune system may take as long as 15 years to develop it. All right. One of my colleagues, gynecologists, was just telling me about a lady who was 20 or 21 years who had stage 1B cervical cancer. Can you imagine? A lady at 20 years and she already has stage 1B cervical cancer. All right. That is really, really frightening. That means this lady was probably infected with the HPV virus maybe 5 to 10 years ago, maybe in the early teenage years, all right? And she probably never had any screening because nobody would even think of screening a teenager for cervical cancer, all right? She probably didn't have any good immune system. She was probably not eating well. But by 20, she had stage 1B cervical cancer. And at that stage, we do a radical operation called bedtime operation, where they are taking away your cervix, the upper part of vagina. And this is a girl who is just 20 years old, all right? And then you are taking off your upper part of your vagina at surgery. I mean, what are you left with? All right, so this is the progression of cervical cancer all the way to established cancer. So this picture shows a normal cervix on the top upper left. You can see a normal cervix. If you can hear me and you're getting some value, please type value. Let me know that we are here. If you can hear me and learning something, type value. Type value if you can hear me clearly. Beautiful, beautiful. So this on the upper top left shows.
Dr. Parker, please, can you put it in presentation mode?
So this picture here shows a picture of a normal cervix on the left. All right, this is the cervix. So as I show you, the cervix is in the upper part of the vagina. All right, and this shows what we call pre-malignant lesion. That means the cells are already affected by the HPV virus and they've started causing changes. All right, so you can see that this cervix looks different from this. All right, so it's just the cells that have been affected. It hasn't gone into the tissue of the cervix itself, all right? And so that is why when we come to the screening, these are the type that we want to catch it and then something can be done. And then this is early cervical cancer. This is an operation that has been done. The whole uterus has been removed. You can see the cervix. And this is a late cervical cancer, advanced stage. And that is the stage that most women present to the hospital in Ghana, all right? This is obviously the stage that they present to, where it is really established cancer, nothing much can be done, okay? So what are the early signs and symptoms of cervical cancer? And these are very, very important that we know about, all right? Bleeding after sexual intercourse. we call this postcoital bleeding. Excuse me, postcoital bleeding. That means you realize that after sex, and you are bleeding, all right? Because of course the penis is hitting the cervix, which has become sore. There's early changes are there, so of course it's hitting it, so it will cause bleeding. So it is not normal to bleed after sex. So if you notice that after sex you are bleeding, please go and see the doctor. And then when you start seeing these signs, most of the time it is late. We do not want you to see these signs before you present to the hospital, okay? If you do what I'm going to tell you to be doing, you are not going to get to this stage at all. Abnormal vaginal bleeding and bleeding in between periods. Okay, sometimes you realize that you're bleeding abnormally. It's not your time for your menses, and you're bleeding. And you in between periods, you're bleeding. You're just bleeding at any time. All right. Sometimes you wash your vagina, you put your hands deep inside and you're bleeding. All right. That's contact bleeding as well. Okay. Bleeding in postmenopausal woman. So if your mother, your auntie, has gotten to menopause, that means she doesn't have a menses anymore, and she reports to you that she saw blood, no matter how tiny it is, even if it is a spot of blood, please don't joke with it, all right? Any bleeding that a woman in menopause sees, it is most often you have to rule out cancer. You have to make sure that it is not cancer, okay? Very, very important. And smelly vaginal discharge, all right? What I read to you earlier from the lady who had a relative having cervical cancer, you remember she said the room was really smelling, all right? So your loved one, now you can't even enter the person's room, all right? And the smell is really, really bad. In fact, the smell that comes out from cancer is generally not a pleasant thing. I remember when I was I once entered the lift with a woman who has breast cancer and the lift closed. God, I mean, you have to hold your breath till the doors open. All right, it is not a pleasant smell, and this is something nobody would like to go through. All right, pelvic pain. That means you're having a lot of lower abdominal pain, and it's because most of the time the cancer is spreading and it's affecting your nerves. All right, and that causes a lot of pain, and the pain is not an easy pain. It's excruciating. I mean, you need the highest level of pain relief to be able to get rid of that pain. And very soon after the pain really wears off, it comes out again. And you know, most often there's nothing that can be done. The person is going to die, but the suffering you have to go through to die, it's also not pleasant, all right? And pain on urination. So these are the common symptoms that a person feels when the person has cervical cancer, all right? So what has to be done to prevent cervical cancer? Now, if you are not taking anything at all from what I am talking about today, at least from this point onwards, just take it serious and just make sure you understand this part, and then you just do as I recommend, all right? So what has to be done to prevent cervical cancer? As I said earlier on, cervical cancer is the only cancer, one of the few cancers which are preventable. You can screen for it and treat it, any early changes, because one, the time that you are infected to the time that you develop cancer, it can take as long as 15 years. So you have all the time to halt it, to stop its progression, all right? And the virus that causes cervical cancer, almost every woman who is having sex has been exposed to it, all right? So you are not spared. Just do what you have to do to prevent it. And now we have what we call primary prevention, all right? And the primary prevention is aimed at preventing the transmission of the HPV virus. Without the HPV virus, you're not getting cervical cancer. So why don't we prevent its transmission? Why don't we prevent you from getting infected from HPV virus? And there are two ways of preventing the transmission. One, modify your sexual behavior, all right? Have protected sex. Always use condom, all right? Do not have multiple sexual partners. Abstain if you can, all right? Abstinence is the first one. The ABCs work here. Abstain if you can, all right? Or if you can't, be faithful, B, or C, use condom to prevent the transmission, all right? That's the first thing. The second thing is to go in for HPV vaccination. Now, this is something I'm sure most of you will be hearing for the first time. There is a vaccine for the HPV virus. I'm sure most of you have never heard it before, but there is a vaccine. All right. So get the vaccine, get vaccinated, and then it helps prevent HPV virus. Now, let me talk a bit about the vaccination here, because it's very important. Most people are unaware of it. Now, in countries like the UK, all right, the vaccine is free and it's given to girls between 8 and 13 years old. All right, it's totally free. Given to girls between 8 and 13 years old. They have a common one called Gardasil, all right, which protects from the HPV virus of 16 and 18, as well as 11 and 16, as well as the other one, 6 and 11. All right, the 6 and 11 causes, as I said, vulvar warts. 16 and 18 subtype causes the cervical cancer. All right, so they have the Gardasil, which is what we call a quadrivalent, protect against this. And it's given to young girls between 8 and 9. Why are they between 8 and 13 years? Why are they catching them at that age? Because they want to give it to them before they even start having sex. Do you get it? But when you start having sex and you are exposed to the HPV virus, you've been exposed already. But why don't catch them young before they start having sex? So that is why girls are targeted at that age. Now, since 2019, they have even extended it to men, to boys as well. So it's given to boys too, from 8 to at that same stage, because of course, men too are the ones that can also harbor the virus and give it to women. All right. So indirectly, it is helping prevent cervical cancer, because if you give it to some women alone, but men don't have it, the men too can give it to more women. All right. So let's prevent it indirectly by giving it to young boys as well. All right. And the vaccine is given up to the age of 25. 2 shots. All right. 2 shots. Unless high-risk women or women, people with HIV infection, they give them 3 shots. All right. And there's studies have shown that even women can even take it up to 25 years, all right? And it still has an effect. And studies have shown that the vaccination has prevented cervical cancer up to over 90% in those countries, all right? Over 90% protection. And young girls who are given the HPV vaccination between 8 and 13, by the time they are 20, when they screen them for HPV virus infection, they hardly find any HPV virus infection within them. That means it's really, really helping in reducing the cervical cancer rate. All right. So you can take it in Ghana. The virus is, the vaccine is available. You can get it at places like the family planning unit of Kolebu. You can get it at Akai House. Whenever I mention the price, ladies say, "Oh, it's expensive." It's between 700 and 800 cedis for a shot. All right. And ladies always say, it's expensive. But trust me, having cervical cancer is 100 times more expensive. All right. And the suffering. So look, if you're on this call, a woman, you have children, you have a girl child between 8 and 13, take care to go and get vaccinated. Unfortunately for us in this country, it is not free. All right. So go and pay and get your child vaccinated. Boys too are given the vaccination. Of course, it helps. The same HPV virus causes other cancers like oropharyngeal cancer, all right? Because HPV is sexually transmitted. And you know, sometimes people have oral sex, all right? So the same virus causes oropharyngeal cancer. That's cancer of, let me use the truth, okay? And other pineal cancers as well. So boys are also vaccinated, all right? And MSM, men sleeping with men in those countries too are vaccinated. Now, secondary preventive. So I hope you have understood it. This part is really, really important to me. Very, very important. Now, secondary prevention is preventable screening and detection and treatment of early disease. Now, the primary prevention is you want to halt the transmission of the HPV virus. Now, the secondary prevention, maybe the person has been exposed to the virus already, like in this part of the world where most of us have not had any vaccine when we're even teenagers. We are even hearing about it for the first time. So you probably have been exposed to the virus. Now you want to prevent and notice, screen and prevent any disease, or if there's any early disease, to halt the transmission. All right, and the secondary preventive measures are things like the pap smear, the popular pap smear that we always talk about. All right, so pap smear, these days there's even a superior one, which we call HPV DNA testing. That is what I do for a lot of ladies who come and see me. That is even superior, all right? That is more objective. That one we are testing for the DNA of the HPV virus itself in your system, all right? All right, it's done similar to the way we take the pap smear, but it is more objective because it's not more subjective like the pap smear. Okay, so we test for the HPV virus DNA. All right, it's very, very important. It's more superior than the pap smear. That is what is done in advanced countries like the UK. All right, they do it, and so that if you do it and you don't see any HPV virus within the system, you can even take the vaccination as well, because you know that you're most likely, if you've been affected by the virus in the past, your immune system has been able to clear it. All right, so there's no HPV virus noticed within your cervical, your cervix. All right, so HPV DNA. When you do the HPV DNA and we should see any HPV virus infection, then you can do the pap smear to see if there's any early changes in your cervix. All right, any early change. Now, the pap smear, you see, when, as I said, the cancer takes 15 years, all right? It starts with affecting your cervix, and the cells in your cervix will begin to look abnormal, all right? So the pap smear will notice these abnormal cells very early, and there are a lot of treatment measures they can use to halt the progression and totally stop it, all right? So now, in the advanced countries like UK, women are supposed to start screening, do the screening from the age of 25 every 3 years, all right? Every 3 years. So they are 50 years. And from 50 years, they do it every 5 years. So they are 64 years. If you are 64 years, if you don't have cervical cancer, you're not likely to get it, all right? So every woman from 25 years, you're supposed to screen either the pap smear or the HPV DNA, all right? You are supposed to start screening and you do it every 3 years. And of course, in those countries, they have a register. They'll email you when it's even your time. Here, it is not done. So please, it is your own decision. It is up to you to protect yourself, all right? So every 3 years, you do your regular either HPV DNA testing or pap smear, all right? Every 3 years, so you have 50 years. And from 50, you do it every 5 years. So please tell your aunties, your mothers, any woman in your life to start doing it. Hope you have gotten it. So that is the screening. But of course, sometimes I make mention to the advanced country because they have the protocols a lot. But I said 25 years. But of course, here, women are starting, we don't use it as a straight jacket that you start at 25 years. If you are talking to a girl, you're taking the history, you know that you started having sex early. You started having sex in your teenage years. You're not going to wait till 25 years to start screening. You started having sex in your teenage years, unprotected. By the time you are 22, you've had 3 sexual partners. You're not going to wait for 25 years. So basically, most of us here, we tell ladies to start screening at 21 years because, of course, we have different behavioral patterns between what the Western countries are. There, most of the ladies have gotten vaccination in their teenage years. All right, here, most girls haven't got any vaccination. All right, so obviously we are not going to wait for 25 years, and depending on your history as well. But of course, if you've not had sex before and you're a virgin, you don't need to do the screening because you are not likely to have been exposed to the human papillomavirus. I hope we have all understood this. I've taken time here because this is the most important part, of course. All right, most of these ones. So this picture shows on the left, this is genital warts. The same, this is not cervical cancer, but this is what? The same HPV virus that causes cervical cancer. All right, it causes genital warts. All right, and this is how bad it can look. All right, so these are not viruses that we joke with. And I talk about the vaccination. We have the Gardasil, all right, which we give 2 shots. All right, 2 shots. All right, but if you are you have your immune system is suppressed, you have HIV, we give you 3 shots. All right. So these are basically some people take it. So these are the screening methods, the cytology, which is the pap smear. We have a visual inspection with acetic acid, and then we have the my HPV DNA. So this is just to show that there are various screening methods for cervical cancer. All right, various screening methods. So make sure this how easy it is being done. We just put, and ladies always say, oh, doctor, is it painful? It is painful. No, it is not painful. Maybe it's just a bit uncomfortable, but trust me, cervical cancer is 10 times, 100 times more painful. Pap smear just takes a few minutes, 5 minutes or less. It is done, all right? 2 weeks later, you receive the result and you know what to do, all right? So it's not a difficult thing at all, okay? So I don't think we need these ones, all right? So these are various other things that's, yeah. Okay, so I like this statement. It says from a past president of FIGO, that's Federation of Gynecology and Obstetrician, women are dying not because of diseases we cannot treat. They are dying because societies have yet to make the decision that their lives are worth living. All right, so please, if you are in a society which is not taking the decision that pap smear, cervical cancer vaccination should be part of national health insurance, please make it your own responsibility and take it, all right? You can't wait for a country to make it part of their protocol. Otherwise, before you realize you've gotten it. And most of our insurances do not cover cancer. That is the unfortunate thing, okay? So the way forward, let's all make sure that we do our pap smear or HPV testing, contact any gynecologist get more educated, and then get vaccinated as well. All right, very, very important. Okay, and I've been talking a lot. I just added this because I've been talking a lot about immune system and how important it is when it comes to cervical cancer. All right, and look, it is not safe to be going to the world, walking around today without taking anything to boost your immune system, to make sure that you have a strong immune system. All right, it's like walking on a time bomb. There's so many things that we are putting in our bodies today that is just breaking down our immune system. That is increasing our risk of getting cancer. Okay, so you cannot just, and we are not eating a healthy diet. That is the unfortunate thing. We are not eating a healthy diet. So it is also part of you to feed your cells, all right? Something that will help boost the immune system. And for me, as a doctor, I always recommend cellgivity, cellular longevity. Cellgivity, all right? It boosts something in your system, in your body, called glutathione, all right? A very important antioxidant, which is known as the master antioxidant, which helps in boosting your immune system, all right? It has a lot of very, very important supplement antioxidant in it. Selenium, it's a very potent antioxidant that helps fight cancer cells and also help boost the immune system as well, all right? Aloe, resveratrol, broccoli seed extract, grape seed extract, quercetin, these are all supplements. All these are in cellgivity and they help boost the immune system, all right? And I've seen a lot of people who have used it and it's really helped them. People whose immune system were weak, people who had HIV, they added it to their medication and it really helped boost the immune system. So please, in the world today, do not move around without taking anything to boost your immune system. Do not move around without taking anything to boost your immune system. It's like driving a car and you're not putting oil in it and you're expecting the car to function at its optimal level. Because the stress we are going through in the world today, the stress alone breaks down your immune system. And that's very important. Stress breaks down your immune. That's why you realize that you're very stressed before you realize you end up with malaria. I remember when I was specializing as a resident, the period that I was stressed the most in the hospital, for the first time I had tonsillitis in my life, all right? My immune system completely broke down, all right? So please make sure you get this product from whoever invited you to join this call and take it and help strengthen your immune system. All right, so thank you all for being on the call. That's my number. If you want to reach me personally, you can always reach me as well. All right, so thank you all. I'm sure you have a lot of questions. I hope the presentation was as short as possible so that I can make time for questions. So please, back to you, Dr. Albert, if there are any questions so that I could take the questions.
Thank you very much, Dr. Parker. Just like I told you, he's always very thorough when it comes to presentations, and he's done great justice to the topic. A lot of things has been said, especially the introducing story where someone who's lived with someone who has had cervical cancer, unfortunately passing away. The experience is real. Those who work in the health facilities, especially the tertiary health facilities, we know these stories. It's very, very common, and it's unfortunate. And like the specialist has said, cervical cancer is highly, highly preventable. Very, very preventable. All we need to do is to do as he is advising: boost your immune system, get vaccinated, have a better sexual life, use protection, or abstain if you can, or stay faithful. You choose one, but just have better sexual life. Now, some people are asking, are we going to get the recording? Yes. Those of us on the call who have not subscribed to the YouTube channel yet, I'm just sharing the YouTube channel again in the comment section. Just take 3 seconds, click on the subscription, and put on the notifications. When we are done, I'll be posting the recorded video there for you to go and watch. Dr. Parker has a lot of other topics that he's dealt in the past, including infertility, fibroid, ovarian cyst. All are on the YouTube channel. Subscribe and go and benefit from it. Now, this is the time for questions and answers, and this is the moment where you get to have the free specialist consultation. The first question that came through was, where can I get the HPV DNA test to be done? Where can I get it done? That's the first question. All the way to Dr. Parker, if you can hand it down for us. If you have any question, put in the chat box in the comment section. Dr. Parker will handle every question for us.
Yeah, so as I said, contact, if you know any gynecologist, contact any gynecologist about it. All right. Of course, family planning unit of Kolebu to does it. Yeah, so you can go to the family planning unit of Kolebu, or as I said, contact any gynecologist as well, and have it done. All right. My number 2 is there. If you want to contact me, you can contact me as well. Okay.
All right. So again, contact any gynecologist wherever you are, whichever region you are. Just contact a gynecologist. Every region has gynecologists. So someone was also talking about the vaccination. Contact the gynecologist in your region, in your district, and he or she knows how to get it for you. Someone is asking a question. I've been having intermittent abdominal pain lately. The last time I had sex, I had severe abdominal pain for like 20 minutes. I went to the hospital and did some tests, but was told nothing was wrong. Should I worry?
Yeah, she said she's having abdominal pain. And please, can you repeat that question just a second? Just repeat the question.
She'll be having postcoital pain lately. She's gone to the hospital and they told her there was nothing wrong. Should she worry?
Yeah, I mean, you are not supposed to have pain during sex. Okay, so if you are having pain during sex, definitely they have to find out the reason why you are having the pain. Okay, so she should just, she has to obviously see a gynecologist. I don't know what kind of doctor she saw. That is what we call dyspareunia, pain during sex. It could be because there's a mass in the pelvis. It could be the endometriosis. It could be PID. It could be a number of things, all right? So she has to definitely see a gynecologist so that she is well screened to know what is causing the pain. Sex is supposed to be beautiful. It's supposed to be fun. It's not supposed to be painful.
All right, the next question is, does someone who frequently has whites, that's vaginal candidiasis, have a high risk of getting cervical cancer?
No. In fact, whites or vaginal candidiasis is not a sexually transmitted infection. All right, white is not a sexually transmitted infection. So that has got absolutely no relation with cervical cancer. Sexually transmitted disease, chlamydia, gonorrhea, trichomonas vaginalis, those are the ones, syphilis, all those things, they are the ones that, of course, has a high risk too, but candidiasis is not sexually transmitted. So no problem with her.
All right, somebody wants to know, so during sexual intercourse, what actually causes the virus infection? That's the viral infection. What happens during the sexual intercourse to lead the transmission?
Yeah, so when you have sex, all right, if the person you're having sex with has the HPV virus, all right, of course, the virus will be in the body fluids like the semen. It will be deposited in the vagina. The virus will attach itself to the cells of the cervix, all right, and it would go into the cells and start dividing within the cells of the cervix, all right. And of course, if you have a strong immune system, as I said, your body may clear it, all right, totally. If your immune system is not strong, or even if it's strong, but you keep on reinfecting yourself, the virus may eventually be able to establish themselves within the cells of your cervix, and they start causing changes there, all right, from dysplasia, we call it dysplastic changes, which are early, the cells are not normal like the normal cells anymore. They have features of early cancer, all right? And so the cell starts changing, starting from your, what we call the epithelial cells or the surface cell. And if it goes on, and these are the time that we want to catch it through the pap smear, cytology. Cytology is basically looking at the cells, all right? And if there's a problem, the cells have got the features which are what we call pre-malignant changes, it can be dealt with. Otherwise, if it's not done, it's established the tissue, the real tissue of the cervix, okay? And then the virus begins to spread. Okay, so this takes can take as long as 10 to 15 years.
All right, somebody's asking, if I test negative, can I take the vaccine? Can my 16-year-old daughter take the vaccine?
Yeah, if you test negative, definitely you can take the vaccine. It means, right, at that moment, your body is not infected. You don't have the HPV virus infection. And of course, you take the vaccine. So now you've taken the vaccine, which is good. You are no longer going to get, you've taken the vaccine, your body will produce antibodies and would be able to fight anytime the virus tries to infect you. All right, but please remember, taking the vaccine does not mean you do not get screened again. You still have to do your regular screening every 3 years. All right.
All right. Can a pregnant woman undertake the test?
Yes, pregnant women can undertake the test. Pregnant women are allowed to, all right? It's even an opportunity whilst they are coming for antenatal, because they're already coming there. It doesn't affect the pregnancy in any way. It has nothing to do with the pregnancy, all right? So it's an opportunity. So this is what we call opportunistic screening, all right? You're already coming to the hospital already. You're seeing the gynecologist already. So it's an opportunity to even screen yourself, all right?
What can you do to prevent cervical cancer when you know your husband has multiple partners?
All right, so this is one of the risk factors. You have a partner who is a high risk partner, all right? And obviously, just screen yourself every 3 years. Take the vaccination if you've not taken it. And that is the best advice. That is a secondary preventive. One of the preventive, there's actually a primary and a secondary preventive measure. Take the vaccination and do your pap smear every 3 years. All right. If any early changes are seen, it can be taken care of. And importantly, to make sure you have a good immune system. In case you are infected, your body is able to totally clear the virus away. Very, very important.
All right. Somebody wants to know, is pap smear on any of the insurance policies? Any insurance company accepts?
Yeah, that's why I said that most of these screening tests are not covered by most insurance. I don't know of any insurance that covers it. Most cancers are not covered by insurance because the treatment for cancers are very expensive. All right. I didn't go detailed into how cervical cancer is treated. I don't think it's too much for this platform. All right. But it's very expensive. You're doing a lot of chemotherapy, radiotherapy, and it's really, really expensive. All right. So most insurance companies actually run away from covering cancer. So it is your responsibility to make sure you do not get it.
All right. Somebody's also asking, if vaginal candidiasis isn't sexually transmitted, why do we sometimes get it from our partners?
You are not getting it from your partner. You don't get it from your partner. It is not sexually transmitted. Actually, the candidiasis, Candida albicans, which causes vaginal candidiasis, it's a normal flora in the vagina. When we say normal flora, is that it lives in the vagina, but it is under control. All right. We have in the vagina a bacteria called lactobacillus. All right. That is the main bacteria in the vagina. There's a lot of acid produced in the vagina. The normal pH of the vagina is about 4. All right. That is it's very acidic. And that kills any bacteria which is trying to grow out of control. Now, when the pH of your vagina becomes imbalanced, maybe because most of the lactobacillus are being killed, you are taking antibiotics unnecessarily, you are putting all sorts of douching things in your vagina, which you shouldn't do, the pH of your vagina is disrupted, all right? And of course, Candida begins to grow. Or when you get other bacterial infections in your vagina, it all disrupts the pH of your vagina. And that is when Candida begins to grow out of control.
All right, thank you very much. Somebody who joined late is asking, what are the early symptoms? Since the symptoms you enumerated mostly come at the last stage.
Yeah, so we do not have early symptoms. All right, we do not have, when it begins to show symptoms, it means most often the changes has gone beyond the cells, the epithelial cells of the cervix, all right? And it's beginning to affect the basement membrane. It's gone deeper. And that is why you're beginning to see the symptoms you are seeing. That's why you're beginning to see the vaginal discharge. You're beginning to see the bleeding, all right? And we don't want you to get to that stage, all right? So there are no early symptoms. The early thing to do is to do the pap smear and not get to that stage.
All right. Someone is also saying that after menstruation, she has about 3 days where she goes through pain, severe pain. Should she worry?
Yeah, but this is not typically suggestive of cervical cancer. All right. Normally, we have what we call primary dysmenorrhea, where you feel pain. Pain during the menses should start at the beginning of the menses and last about 2 days. That's primary dysmenorrhea. It is normal. But when the pain goes throughout the whole of your menses, all right, so that last day you're still feeling the pain, or even after the menses, it is what we call secondary dysmenorrhea. And most often it's because there's something wrong in the pelvis, all right, there's a pathology. And you have to see a gynecologist to be assessed to find out why you are having the pain.
Somebody is asking, can recurrent vaginal infection lead to cervical cancer?
Yeah, as I said earlier on, and this slide, history of sexually transmitted infection. It's a risk factor, because if you are getting sexually transmitted infections often, it means you are living a high risk life, all right? You are having unprotected sex a lot with a partner who is also probably living a high risk life. So if you are getting other diseases, it means you are probably exposing yourself to the HPV virus also a lot, all right? So that puts you at risk.
Somebody is asking, what is cervical polyps and how serious is it?
All right, so polyps are also abnormal growth. It can occur within the uterus as well, all right? They're just an abnormal group that normally have a stalk, all right? They are not related to cervical cancer, all right? They are mostly benign, all right? Benign means they are not cancers, okay? And it's something that can easily be dealt with a gynecologist.
Okay, somebody is asking, if someone has warts, does it mean the person is likely to have cervical cancer?
Yeah, so I mean, if you have warts, that means you've been exposed to the HPV. But the strains that cause the warts are not the strains, the subtype that cause the warts are mostly not the subtype that causes the cancer, all right? But of course, it means the probability that you've been exposed to those type 2 is very high. Okay, so it means you should take your screening very, very serious. All right, yeah.
All right, and somebody's asking, do you have to take the vaccine just once?
You have to take what once?
The vaccine, the HPV. Do you have to take the vaccine just once?
As I said, the common one in Ghana is Gardasil, all right, which is available in Ghana, thankfully. It's about 700 to 800 cedis. And you take it twice, 2 shots, all right? Each of them is about 700 to 800 cedis. You take 2 shots. If you're a high-risk person or a person with immunosuppressed, like an HIV patient, normally you take it 3 times, all right? And I said normally, in the advanced country, they give it up to 25 years, all right? And they start between 8 and 13 years. That's the time they give it to the girls and boys. But nothing prevents you from even taking it up after 25 years. So far as you are doing the HPV DNA test, you know that you don't have the HPV, you can still take the vaccine and it's protective.
So after the first vaccine, what's the time interval to the second, please?
It should not be more than 6 months.
Okay. Doc, since people keep talking about vaginal discharge, white, could you let us know if all vaginal discharges is caused by candidiasis, please?
If what?
All vaginal discharges equal to vaginal candidiasis?
Okay, let me, the time interval for the vaccines, I have the Gardasil here, day 1, then 60, and 180 days. That's for those who are taking it for the 3 shots, all right? So that is the, Cervarix is mostly not in Ghana, all right? So for Gardasil, that's the schedule, all right? So not all discharges candidiasis. Look, that is the problem a lot of ladies make. Now, vaginal discharge is something you do not joke with because of the consequences if you don't treat it well. Now, a vaginal discharge, you are saying, could be due to chlamydia, gonorrhea, any STD, all right? And if not well treated, it can cause PID. It can cause tubal blockage, which can lead to ectopic pregnancy or infertility, all right? But the problem is that as soon as any lady sees a vaginal discharge, oh, it is white. Every vaginal discharge is white. Not every vaginal discharge is white. You should always think of the worst than think of white, because if you keep on thinking it's white and it is any of the serious one that can cause all the things I've mentioned, then you're not helping yourself. Other things ladies do is when they have discharge, they call their friend. Oh, the last time I had the discharge, the doctor gave me this medicine. They send a picture. And the lady goes to buy the same medicine. Not every discharge is the same. There are so many discharges which you need a doctor to be able to tell you and diagnose you accurately. Now, the third mistake that ladies do, which is sometimes the most first one, is that they walk to any pharmacy shop and they go and tell the pharmacist or a chemist, oh, I have a discharge. And then the pharmacist or the chemist will just take the medicine for them. The chemist or the pharmacist is not trained to diagnose vaginal discharge and know the features of, he doesn't know the features of chlamydia, he doesn't know the features of gonorrhea, he doesn't know the features of trichomonas vaginalis, he doesn't know the features of bacterial vaginosis. How would he treat you accurately? All right, see the qualified person to be treated. Don't take the easy routes because you want to save money. At the end of the day, when you end up with ectopic or PID or infertility, you will spend far more money. All right, so please, not every discharge is candidiasis.
Thank you very much for clarifying that, because a lot of ladies just generalize every discharge as white, and that is not what it is. Go to the hospital, get proper diagnosis, get proper treatment, no shortcuts. That may be a warning of something sinister, all right? So there's a question, doctor, please, if you give birth to cesarean section and tie your tubes and have sex after 4 months and see little drops of blood, is there any cause for alarm of cervical cancer?
Yeah, as I said, it may not be, but when you see some of the things I've talked about as the symptoms, just go to the hospital and just be sure that it is not a postcoital bleeding. I mean, normally you're not supposed to bleed after sex. So if you are seeing that You don't lose anything by going to the hospital, see a gynecologist, let him examine you and get reassured that, oh, this was nothing, all right? Because it could be that it could be cervical cancer because you're having postcoital pain. Of course, it could also not be, but it's best to go to be examined to be sure that it is not, all right? That is always the best thing.
Yes, prevention is better than, cure. 34-year-old who has had hysterectomy, is she at risk? Should she vaccinate?
Yeah, so generally, when you have hysterectomy, we take out, it depends on the kind of hysterectomy you have. I don't know which type she had. There are some that we take out the cervix totally, and there are some that we leave the
She had
cervix.
total.
Okay, so the cervix has been taken away totally, so there's no cervix there to be affected by cervical cancer, all right? Because the cervix is totally out of the way.
It's just like, say, if you don't have a head, you can't have a headache. So if you don't have a cervix, you can have a cervical cancer. All right? Okay. If you have any more questions, please, on YouTube, on Zoom, please feel free. You can even post a question anonymously on Zoom. Feel free to put it in the comment section. Dr. Parker is answering every question. This is a time for free specialist consultation. All right? We have a lot of things that we are all learning here. Yes, if you don't have a headache, you don't have headaches. So if you don't have cervix, you're not likely to have a cervical CA. All right? Somebody wants to know, even though you answered already, but somebody who joined late is asking, how much does the test cost?
Which test? Okay, so that there are various, the prices differ from lab to lab, all right? It differs from lab to lab and which one you are doing, all right? I basically, I do the HPV DNA, and I do it MDS Lancet, which is a very popular lab. I mean, every doctor knows MDS Lancet, internationally recognized. And so I do the HPV DNA. The HPV DNA with MDS Lancet is 450 cedis. All right. That's how much it costs. All right. The pap smear too varies between 300 and 5, depending on which lab you are doing it, actually. So by any of the labs, between 300 and 500 should be able to do it. Okay.
How about the vaccine? How much is it per shot?
Yeah, so I said between 700 and 800. You can have it at Kolebu Family Planning Unit, Akai House too, I think they do it. Yeah. Yeah. Somebody even on this call, I don't know, the person's on the call. The person sent me a message that he's the medical rep for the people who bring Gardasil vaccine to Ghana. I think the person is on the call. I don't know how the person got on the call, and it's just giving me some information on WhatsApp about the vaccine, Yeah. So.
Oh, that's great. That's great. That's great. I wish the person could send me a message so the person can. Okay, no problem. We don't have time. All right. Any more questions? Yeah. So now, you join us late, Fafali. You join us late, so you listen to the recording on the YouTube page. All right, please, so that we don't go back. All the questions you're asking were thoroughly expatiated on during the presentation. Any more questions? If your husband has hepatitis B, can you, the woman, get cancer due to that?
Oh, so if your husband has hepatitis B and you are not vaccinated, they are also at risk of getting hepatitis B. All right, because hepatitis B is sexually transmitted. All right, through body fluids as well. Okay, so if your husband has it, and test yourself first to make sure you don't have it. If you don't have it, then quickly take the vaccination and then you are safe. I mean, because women with hepatitis B, the challenge is also with their child when they get pregnant. All right, the child is also at risk of getting hepatitis B. So it is very important that women protect themselves for hepatitis B. There's a vaccination for hepatitis B. You just get tested and then you get the vaccination.
All right, so Jennifer is asking again the question that was just answered. The cost of the vaccine, Dr. Parker says, is between 700 and 800 Ghana cedis. You can get it at Kolebu, you can get it at Akai House, all in Accra. But the best is just link up with your gynecologist, and he or she knows how to get you the help that you need as well. Somebody's asking for the YouTube link. It's in the comment section. I just posted it.
So the Gardasil rep in Ghana, he says The Gardasil is given from 9 years to 13 years, up to what I said. And it's given for two doses. 2 doses. First dose given, and then 6 months later, the second dose is given. I mean, that's why I said it. Not within 6 months, you give the second dose. All right. That is between the ages of 9 and 13. But when the person is older, from 14 years, they recommend 3 doses. From 13 years, they recommend 3 doses because, I mean, it's all because older people are more likely to have started having sex, and so they are more exposed, all right? But when you take it within the between 9 and 13, so if you're a woman here, a man, you have a daughter, early teenage years, she just takes 2 doses. But if you're a woman here, after 14 years, 25 years, 30 years, you may need to take 3 doses at 0 months, then the second dose at 2 months, and then the third dose at 6 months from the first dose. All right. So within 1 year, you've gotten all the doses. And thankfully, we have the Gardasil in Ghana. There are times that we don't have it. So women have no choice, but we have it. And you have the information that we have it. So if you don't take it, it's your choice.
Somebody is asking, is the Gardasil available in other regions apart from Accra?
All right, let's ask more questions. I'll get you an answer for that.
Okay. Can a 22-year-old go for the shot, the vaccine, without screening first?
It's always best to screen first. It's always best. Every vaccination, like these things, it's always best to screen, like hepatitis. You can't go and get the hepatitis without screening. Because if you have already been exposed, then you have the antibodies in your system. Why the need for the vaccination? All right, so you always have to screen before the vaccine. And then I've said it, even if you have vaccinated, you have to still screen. You do not, the vaccination does not mean you don't screen again, because there are so many subtypes of the virus. Do you get it? And the vaccination covers only the 4 of the subtypes. So even if you have gotten the vaccine, every 3 years, you still screen till you are 50 years. After 50 years, you do it every 5 years till you are 64 years.
All right. So someone is asking, if you've not had sex before, should you take the shots? I'll allow you to answer.
Yeah, that's even the best time to take the shots. All right. That's the whole idea why they give it to girls between 9 and 13, because they've not had sex before. I mean, most often. All right. We want you to get the vaccine before you have sex. It's more effective that way. All right. So if you are even 30 or 25 and you're a virgin, bingo, then you can take the vaccine. That way you don't even have to do the screening first because you've not had sex before. So you can just straight away take the vaccination.
A very important question. Somebody says, after taking the 2 to 3 vaccine shots, is there still a risk of you having cervical cancer?
Yeah, there's still a risk. That is why I said you still have to be doing the pap smear or the HPV DNA. Even though your risk is very minimal, as I said, studies show that it's prevented over 90% reduction in cervical cancer from those who have taken the vaccine. So it really prevents it. I mean, your risk is very minimal. But the fact that they are saying that you should still be screening means it is not totally 100%. You know, most vaccination cannot be 100%. That's why COVID, you take the vaccine, people take it, but they still get this thing. But of course, it gives a very good, reduction in the incidence of getting it.
All right. So the one who asked about the partner having multiple sexual partners is saying that she's tested for HPV. The doctor says she's okay, but she wants to know, does the partner having multiple sexual partners increase her risk of having cervical cancer?
Yeah, because it's a risk factor. A high risk partner is a risk factor. Let me show you that slide of the risk factors. Having a high risk partner, because then that means you keep on getting infected with the HPV virus. All right, you keep on reinfecting yourself. All right, a high risk sexual partner is there. it increases your risk. All right, because you keep on reinfecting yourself. So the only thing you can do is do the HPV DNA testing or the pap smear, and every 3 years, and take the vaccine. All right, and every 3 years, keep to your schedule of doing the HPV DNA testing or pap smear, whichever one you want to afford to do. All right, but as I said, the HPV DNA testing is superior and more specific and more objective. All right, because that one they are looking for the virus itself. All right, the pap smear they are looking at changes in cell cytology. It's more subjective. All right, but when they do the HPV DNA, that's all a first line in the advanced country. That's the first line. HPV DNA is the first line. So when they do it and they see that you have the virus, then they will do the pap smear to see if it has started causing changes on your cells. But if they do the HPV DNA, you don't have the virus, they don't need to do the pap smear, then you just be repeating it every 5 years, every 3 years, sorry.
All right. Thank you very much, Doctor. It's been an extensive, thorough presentation. Those who join us late, don't worry. The recording will be made available on the YouTube channel. Those who have not subscribed to the YouTube channel yet, just take 3 seconds. I've shared a link again in the comment section. Take 3 seconds, click on it, just subscribe, and put on a notification. Dr. Parker has had lots of other topics in the past with other ones as well. Somebody says her question wasn't answered. Zuri is going to be sure I got you. Yes, Zuri, it's one dose that goes for 800. One dose, not all the 3. One dose is that's the one that goes for the 800.
So if you are in other regions and you can contact me, and I'll try as much as possible to find out from my other colleagues where you can get the vaccination from. Okay.
All right. Okay. Somebody sent me a message on WhatsApp saying somebody has a foul-smelling discharge, vaginal discharge, and has been to see the gynae, and some tests were conducted. All the tests were negative. What is the next line of action?
Oh, but I mean, it's not normal to have a foul-smelling discharge. It means there's something definitely wrong. I mean, and as doctors, we don't treat labs, okay? The labs are just supportive. So if the lab says there's nothing there, but I am examining you and I'm seeing that there's definitely something there, the type of discharge and the smell even helps us diagnose. You still have to be treated.
Yes, so just have to make sure you go see your gynae and thoroughly investigate it. There has to be a cause for the discharge, and that has to be investigated thoroughly, and you will be treated. Thank you very much, Dr. Parker. Again, those who join us late are asking, can we get the recording and all that? Yes, it's going to be available on the YouTube link. Feel free, subscribe, and you'll get to have all the benefits. There have been a lot of other lectures in the previous weeks that you have access to as well. Dr. Parker has been very thorough. In the next 30 seconds, Dr. Parker spoke about screening, getting vaccinated, and prevention, which is boosting your immune system, boosting your immunity. And he recommended a product. If you want some, please go to the friend who shared the link with you. Contact myself or Dr. Parker, and you're going to get any of the product that you want for yourself. All right. Somebody's also saying has a question. Yeah, Coco. If you can pose your question again, please, we'll be glad to help you. I have skipped it unintentionally. Sorry. Kindly help me post it again so that Dr. Parker helps you with the answer. Yeah, Coco. Yes, your question was answered. Dr. Parker says once you have post-coital bleed, that is bleeding after sex, you have to go for proper screening. It is not normal. That's what Dr. Parker said. Yeah, Coco. That's what Dr. Parker said clearly. All right. Yes, I'm sure your internet had an issue. Dr. Parker answered that question. He answered every question. So next 30 seconds. If anybody has any last minute question, please post it. You know, you have the option. You can even post it anonymous, and Dr. Parker is going to respond. 30 seconds. Can the test be done when menstruating, Dr. Parker?
No, we don't do that test when I'm menstruating. So after your menstruation,
all right,
you menstruate only within 5 days in the whole month. You have the rest of the 25 days to do the test. So menstruation shouldn't be a hindrance to doing the test. All right. So please take home message. Everybody gets either pap smear than HPV DNA. Contact any gynecologist. If you want to contact me too, you can contact me. Do it. Take the pap smear. Don't keep this message to yourself. Spread it. Tell every woman in your life. Make sure your mother, your auntie, your sisters, they are doing it. There's so much ignorance about this very, very important topic. All right. So you see women highly educated to the highest level, PhD, but they know absolutely nothing about cervical cancer. All right. So please spread the message.
Thank you very much. Spread the message. Let more people get to know about this. All right. Spread the message. What you've learned, share it with them. Share the YouTube link. Let them go and listen to Dr. Parker. They can ask questions on the YouTube comment section. We will respond to it. All right. Now, Fafali, yes, Dr. Parker says once you're having pain during sex, you should worry. Go see your gynecologist. We're not asking whether the sex was vigorous or not vigorous. No, it doesn't matter. Once you're having pain during sex, go and see your gynecologist. Whether it was vigorous sex or smooth sex, doesn't matter at all. That's what, Dr. Parker, am I right by saying that?
Yeah, yeah.
As long as you're having pain during sex or after sex, go and see your gynecologist. Don't take advice from people who are not qualified to give you such an advice. That is why we have this opportunity to hear from the expert. All right, that's why we have opportunity to hear from the expert. Ruth, I've shared again the link of the YouTube channel. Just go subscribe to it, and the recordings are going to be there for you. Make sure you share the recording with your friends as well. All right, Dr. Parker's details are on the screen. Dr. Parker, somebody is asking for your details, so it's on the screen. Feel free. Fafali, the link is here. The link is there. If you see the link, let me know, Fafali. If you see the link, let me know, Fafali. Dr. Parker's details are on the screen. If you want to link up with him, especially, please go ahead, call him. He's giving permission. So, Fafali, let me know. Ruth also says she can't see the link. Oh, Ruth, you should be able to see. It's in the comment section. Scroll up if you have to. I've shared it again, just 2 seconds. All right, so nobody has any question? All right, so thank you very much. Thank you very much, Dr. Parker. We appreciate your time spent with us. The recording we made available to all of us. It's been an exciting and a very educative session that we've had. If you can't see the link, just go to YouTube, Dr. Albert Sedo here. Just type Dr. Albert Sedo here. You'll get my channel link there. You subscribe, and then you have access to all the recordings. It's not recorded on Zoom, it's recorded on YouTube. So you have it all there now. Fafali, I'm happy you have seen it now. Great. So yes, don't keep this message to yourself. Dr. Parker says there are women highly educated who are not even aware that not all vaginal discharges is caused by or is vaginal candidiasis. There are highly educated women who don't know. We've come to learn. Don't keep this message to yourself. Share with as many people as possible. It's very insightful to know that boys are also getting vaccinated. The vaccine is available in Ghana. We have the rep. The rep can make his contact available to the Dr. Parker, do we have the answer to the question that do we have vaccine in other regions? Do you have the question? So we will get answer to that question later on the YouTube channel. Yeah, you get to listen. Sarah Opoku, just see the YouTube channel, subscribe, and you'll get the recording made available on the YouTube channel. Sarah Opoku, all right? The YouTube channel is there. Go subscribe and share with as many friends as possible. Once again, thank you very much, Dr. Parker, for making time to share this very important with us. All right, thank you very much. We appreciate it. Oh, last question, Dr. Parker, last question. Should a 50-year-old go for the HPV injection or the pap smear?
Oh, at 50 years, I think she should be doing the HPV DNA or pap smear, any of them. Yes. She should just be doing it, unless she's having multiple sexual partners at 50 years. Or the husband is having. But at that stage, I mean, just the HPV DNA or a pap smear, regular pap smear every 5 years, it's okay till 64 years.
Okay. All right. So Ruth, if you want any product that will boost your immunity, that's LGBT, Link up with your friend who shared the link. Link up with Dr. Parker or myself, and you will have it. All right. Thank you very much, everyone, for making time. Join me, say a big thank you. Please type it in the comment section. Let Dr. Parker see you appreciating him. Type it in the comment section. Thank you, Dr. Parker. Let's all type it together. Thank you, Dr. Parker. Let's all type it and let him feel loved. All right. This is free education. You won't get this in a consulting when you go. There's no time, but you have free access here. Please, let's all type, thank you, Dr. Parker. Let's all appreciate him. Yeah, I see the God bless you ones as well. Yeah, God bless you, Dr. Parker. Thank you, Dr. Parker, for making time for us. Yes, thank you very much, every one of you, for joining as well. And of course, agreeing to share the good news to as many of your friends. The recording we made available 10-15 minutes after the call is ended. I appreciate you all. Thank you all very much. Until next week, when we come your way with another exciting topic, please stay tuned and have a lovely day.